My name is Rehema Chengo. I'm the coordinator for the Africa CDC Pact project. So there's Kenya and there's HQ. INFINIT is the agent that implements for Africa CDC. I support them to consolidate and matters of implementing the project in the countries. This Pact project is a brainchild of the committee from Africa CDC, AU member states and Africa CDC. So this is how the Pact project came up. So it was an initiative to ensure that community health workers are involved in at least supporting the management and stopping of the pandemic. So community health workers work at the community. So this is the lowest level of, if I'll say, healthcare. So we wanted them to get some knowledge and at least try to do the prevention at their level, at the level of technical understanding. So we started the project. It was rolled out, and we were supposed to train 100,000 community workers to start fighting the pandemic in all the Africa member states. It was a good, I think, ambitious idea. When we came to the ground, it was very difficult coordinating them. Most of these people are in remote areas. Some of these people don't have a phone. They still use the neighbor's phone. Started training. Those who had mobile phones were trained. We were really risking face-to-face, but somehow the ministry has a way, because there's always a structure, the committee, the subcommittees, it's always the same, almost. It's just the structure is almost the same in all the countries. So we had that, but it was minimal, it was taking longer. And when now data collection came, they need the data every 2 weeks in AU. And the data is down deep at the very remote areas. How do we get it out there? So it was a rough time. Coordinating, first of all, you have to wait for the ministry cycle. So it was really difficult. So we really were looking for technology to help us to move to the next level. If you can get a data collection app, it will help, because that means we can still get the data in the system before it gets the approval, from the different levels. So we shall be cutting all this, time wasting as we wait for the data to move to us, now that we can't move to them. Finally, through our sister project, which is the Accelerator, they referred us, and we started communication with Benjamin and his team, and then we started building the database now. We shared the data collection tool because we were mainly looking at how fast do we get the data. It was really a big relief, but also there was a challenge. The group that we are working with do not have Android phones. So there are countries that have embraced. Malawi and Zambia use the app to report. Senegal, we are struggling because also West Africa, they have a problem of, in the remote areas, data. We have now rolled it to Rwanda. The tool itself has 10 indicators. Number one, maybe just you enter, but you'll find maybe number 2.7, because it's just 2.1, 2.2 until 3.1. So that already is not short, so it is long. So that's already also may make the community health worker feel like it's too much work. One form is too much already. Yeah. The project was actually to be for 6 months. Then we pick other countries. It is in 2 phases, phase 1 and phase 2. Phase 1 is the pilot, we say 3 countries. Then we took 5 countries. The project has a prospect of extension. Is already there. Now we are looking for 1-year extension from now. 2, we are also, the app really came in at a good time. We will not have been here. Currently 32 member states are active, and out of this we were subdivided into subcommittees. And I came back and ensured and collected more people so that every subcommittee can be represented, so that we get to know what happens in the other subcommittee, and if anything happens, we are on top and we are able to grasp those opportunities. We are at the Monitoring and Evaluation Subcommittee, which is now looking into the data that was collected and to improve on the way forward. This January, we were able to report all the 8 countries. So I think that will be an improvement. So I owe this improvement to the support of the Sabasi app. I don't have to start following Florence, who is in Malawi. Kindly let me have the data, because I may just be in a meeting and they would want to know how are the cases in Malawi or South Africa or Zambia, and I can quickly go to my dashboard and just see so far by that date, because it is real time. So since the data is real time, it really has helped us to be able to quickly, get information. It has made muscle work easy, because now I can be able to coordinate better. Sometimes you have to wait until end month, then you receive a report, and then you find out that there were things that you should have, intervened long time ago. Now it's too late. Now it's too late. But with the data, you can quickly say, yeah, I think there's a surge in South Africa, or the new variant now is in Zambia. We have seen a lot of, rising of the numbers, as I am in this technical working group, and it's picked up quickly. And yes, I have also had an opportunity to introduce our success, what made us, being able. A report is to come from, all the way down from the community, and the person reporting is at the national level. So you find that they will tell you there was no logistical for us to even take the, or photocopy the paper to, that side. The next step is that we are now looking forward to sharing this. I'm writing to the 8 countries to get the MOH, because I sent an email last week to ask them if they are interested. They all came back overwhelmingly that yes, with the reports, they would like the project to have an extension. So I'm just giving them, I was just drafting the letter to show them how they should address it to who and what should it include, so that they can now review and give individual feedback to these countries. So at least 1 year, I feel we will enjoy this project, this program. Just have 4 recommendations. 1, they get the community health workers, or give them a grant even for the phones, so that they are able to have data and record and have real-time data, which is what the project really wants and is looking for. 2, if we can also just top up data, even if they won't give the form, they still give data so that they can able to transmit, the information. Then just have, even if it's just 2 face-to-face meetings, that the first face-to-face meeting, you can do everything. Give them the form, update them on the Sabasi, show them what they need to do, probably train them on what they need to know, so that you just like mentorship. It will really do. 4th recommendation is probably now engage, go back to extend the data collection, because it won't work if the contract ends with Open Institute. So we have to work together, because I'm sure the extension coming into 2 forms: adding more volunteers or moving to other side, yes, to moving to other side or other countries.